The massive surge in COVID cases in China has caused India to take note and be cautious. The centre has formed a series of preparatory steps, and Health Minister Mansukh Mandaviya will hold a review meeting with top officials and experts today on the pandemic situation. The government has said samples of all COVID positive cases should be sent daily to INSACOG genome sequencing labs mapped with all states and union territories. INSACOG is a forum under the Health Ministry to study and monitor various strains of COVID in India. An excerpt of a letter from Health Secretary Rajesh Bhushan to all states read, "In view of the sudden spurt of cases being witnessed in Japan, United States of America, Republic of Korea, Brazil and China, it is essential to gear up the whole genome sequencing of positive case samples to track the variants." Bhushan further wrote, "Such an exercise will enable timely detection of newer variants, if any, circulating in the country and will facilitate undertaking of requisite public health measures for the same." According to data from the Union Health Ministry, India has reported 112 fresh infections over the last 24 hours, and the number of active cases currently stands at 3,490. China is reportedly struggling to contain a surge in COVID-related deaths after an abrupt shift from its zero-COVID policy that imposed strict lockdowns and mass testing. The zero-COVID strategy had sparked massive protests in the nation. According to reports, in the recent spike of cases, hospitals have been overcrowded and pharmacies have run out of medicine. Reports said that crematoriums in China are working overtime. According to AFP, Chinese authorities said that it is impossible to track the progress of the virus. Local authorities in Beijing reported just 5 deaths from COVID on Tuesday, up from Monday's 2. Beijing health officials said only those who had directly died of respiratory failure caused by the virus would be counted under COVID death statistics. In cases of Omicron, most deaths take place from post-COVID complications.